All right, we'll begin with our invocation. Father, we thank you for this board. We thank you for the opportunity to be a part of a board that can make an impact. And we'll begin with our invocation. Okay, something's not working here. Father, we thank you for this board. We thank you for the opportunity to be a part of a board that can make an impact. And we'll begin with our invocation. Okay, something's not. Patricia, just a question. I just wondered if we would have a problem with recording if I'm not in the.
No, I'm sure it's
Is it?
But could you try?
The microphone.
I think I took care of it.
Okay. As you're noting the mission and vision statements,
What's the MAC meeting?
the next thing on our agenda is going into our first opportunity for public comment. And I'm going to just, as you know, we welcome public comment. We're thankful for every person who is here and who cares about the work of Community Mental Health of Ottawa County. We're very glad you're here and very glad you speak. In order to continue to have things go in an orderly manner, just wanted to remind you of a few things as far as public comment. Every meeting begins and ends with the opportunity for public comment. And comments are also accepted online. And we are doing sign up as people arrive, just again, to help us proceed in an orderly manner. Typically, we give 3 minutes for each person if they want to give comment for that long. If the number of people signed up is larger, we may reduce that time. And I would announce it at the beginning of a meeting based on the number of people who have signed up. And also, as far as procedure, as the chairperson, I ask that those comments are directed to me, and rather than to maybe another person who has spoken already or to any particular individual board member. And I also, Patricia helps with timing and she gives me a little signal. So I do let you know when your time has elapsed. The design of public comment is that we take information in at that time and we take your comments very seriously. It is not designed for discussion or debate, just receiving those comments from you. You also have other ways that you can communicate with any of us as board members, either through email, phone calls, or individual meetings to discuss things with you. And we welcome that. I just can't underestimate that we want your opinions. And then we just ask that you make any comments in a calm and respectful manner. And again, to address me as the board chair when you're making your comments. And that's it for what I wanted to just remind everyone of today before we start with our first opportunity for public comment. And we have one person, I believe, signed up who wanted to speak today. Thank you.
Good afternoon. My name is Sheila Detloff and I live in Holland Township. In December, you all approved contract extensions for 4 social rec programs, including the Momentum Center. That's apparently not what Joe Moss wanted, so he tried to illegally override your approval in the last Board of Commissioners meeting. Unfortunately for him, he got caught and he removed the motions from the agenda. There were already 3 commissioners on this board, but when a member of the general public with impeccable credentials resigned, Moss replaced him with an unelected 4th commissioner, which I have to presume is to help ensure that votes will go his way. So Michigan law allows up to 4 county commissioners on the board, but the perceived intention of that statute is to accommodate boards that serve multiple counties. For example, if a CMH board serves 5 counties, a 5th county commissioner can be added by Michigan law, but the board size then needs to increase by 1 as well. So in other words, the intent of the Michigan law is to ensure that there's adequate representation by members of the general public who have an interest in how the community mental health is run. For comparison, in Allegan, 2 of 12 seats are occupied by commissioners. In Kent, 2 of 12 seats are occupied by commissioners. In Muskegon, 3 of 12 seats are occupied by commissioners. And in Macomb County, 2 of 12 seats are occupied by commissioners. So why does Ottawa need 4 commissioners on this board? The last time that general public seats were open, no one mentioned adding a fourth commissioner. 22 residents applied, 22. As part of the interview subcommittee, Gretchen Cosby said, quote, "We had wonderfully qualified candidates. It was a really hard decision," unquote. She even singled out one resident who was not selected as, quote, "outstanding," unquote. But this month, she voted to replace the county resident that she selected with another commissioner. I know this is not your decision to make, but I hope those of you who are rational thinkers on this board see what's happening here. Also, for all of you who voted to defund the Momentum Center, I want to remind you once again that on December 18th, Barbara Lee Van Horsen offered to sit down anytime, anywhere with any or all of you to discuss your concerns and mutually decide how to address them. Have you set up a meeting with her yet? If not, why not? And are you really seeking solutions, or are you just grandstanding? Thank you.
Thank you. Is there anyone else in the room who has a comment that they would like to? Is there anyone online who has a hand raised who would like to make a public comment at this time? Okay, then we're closing our public comments for the first session. Moving on to item 5, consent items. Is there a motion to approve the agenda for the January 22 board meeting and also the December 18 minutes from our last meeting?
So moved.
Second.
It's been moved and seconded. Is there any discussion? Hearing none, all in favor, please indicate by saying aye. Aye. And opposed, same sign. The motion carries. And we'll move into old business. Is there any old business that we need to address today? Hearing no old business, we'll move to the next item, which is the new business. First is looking at our service contracts, attachment A, and we have Bill Phelps here to talk us through the contracts. Thank you, Bill.
Okay, good afternoon. I'm here today to request your support for the following 25 contract. The first one is for Trinity Health Muskegon, and that's a continuation contract for inpatient services up in Muskegon site. The second is Community Action House, and this is an amendment for our current contract to have more, what are they called? The food club memberships. We're going to go with full year memberships besides monthly, which we did in the past. Third one is for Kaizen, and Kaizen is a transportation service. It's going to assist us with getting folks to and from different appointments and whatnot. The next one is Jiva, and Jiva is our software package that helps us when providers are having issues with either billing or claims or that type of stuff. It's to help the communication loop. Next two are for the University of Michigan. And this is a two-part contract. The first one is for the administration portion, and the second part is for the clinical portion, where we have staff person who helps us with the MC3 program. This number 7 is the Agnes D. That's an adult foster care home down in Fenville. We'll be contracting with them to have a person placed in that home. Number 8 is for deaf and hard of hearing services. For interpreter services, there's a rate increase to cover that. Number 9 is with IBH Analytics, and that's going to be staffing to help us with a couple of projects that we have. One is our MIMBUS, and that's data that we send to the state. And then the second is with our CCBHC reporting. And then number 10 is for PT Solutions, and that's for physical therapy services. And then it gets easier. The next 15, 11 through 25, all the same for the most part. It's rate increase for all of our autism providers. And that was a rate that was agreed to upon as a region. So it'll be a regional rate. And those are the 25.
Hey, Bill, if you don't mind staying up there for just a minute, before I call for a motion, does anyone have any questions? I know it helps us so much that you sent those one pagers out and you sent them in advance, which we greatly appreciate. But does anyone have any questions regarding the contract summary that Bill just reviewed for us? Any for Bill first?
Yes, I do.
Okay.
Turning the attention to the Community Action House. I'm wondering, is the Community Action House, is that a HIPAA covered entity or is it regarded just as a business associate?
Is it a HIPAA covered entity? So you'd be meaning that there shouldn't be protected health information going back and forth and whatnot?
Well, there are rules about that, use
Yes,
and
yes.
disclosure of that
Yes.
information.
Yeah, so then with the contract that we have with them, that's a vendor agreement. I'm trying to recall if there's specific HIPAA, like there's with our general contract. I'll have to go back and look. That's okay. Yeah,
So is it, if I understand you correctly, is it a covered entity in of itself, or is it under a business associate contract?
that's correct.
So it's under a business associate contract is what it is?
Yeah, I'm sorry, I'm reading what you're saying because I'm hearing impaired.
Oh.
So I just want to make sure I'm understanding right. You said it's the business association contract. We have the contract that we have with them is, I believe, a vendor agreement, but I can pull it up and look at it. Want the specifics?
Yeah, because I mean, there's a distinction between, what's a covered entity
Sure.
and then providers that are hired to have to basically follow the HIPAA regulations, and you set up a business associate contract to do that. So I'm trying to make sure I understand the relationship then between CMH and, Community Action House. Another question I have is, could you explain a little more detail about this CCBHC expansion grant as a funding source? And I'm assuming it has various criteria requirements that have to be complied with. And I was wondering if you could discuss that.
If it's possible, could I want that?
Yeah,
What numbers?
so the expansion grant is the CCBHC program that went from being a SAMHSA funded grant to funding coming out of Michigan Department of Health and Human Services. It's we know we have two CCBHC grants at the moment. One is an I&A grant, and then the expansion is the state-run program.
Well, and I guess, and frankly, I have a lot of questions about what the CCBHC is. So I'm struggling with just the idea about what the grant is. I'm assuming there are certain requirements or things that have to be fulfilled in order to have
Yes.
qualified and spend this grant. And I was wondering what that might be.
Well, it's a pretty extensive grant. It's like an extensive program. So honestly, if you'd like us to do a presentation on that, it might be a better means of giving you all that information. I didn't come prepared today to give you a presentation on CCBHC, but we can easily schedule that.
Well, that's something I'd like to do. Is if either we have a presentation, maybe it's a retreat like we had back in the fall.
Sure.
Because this CCBHC, to me, is frankly somewhat of a mystery. And it really gets me to thinking about how it is running in parallel to CMH, or how it is perhaps transforming CMH. And I need to have an understanding if it's a transformational thing, where are we going? What does CMH look like? And as far as parallel, I guess, what's the infrastructure of this? I mean, who are we working with? Where are the parties to this? And what particularly are the measurable goals and objectives so that we can objectively say we're achieving what our goals are. So yeah, I would really welcome that because I think it's really hard for me to make an informed decision on voting on any of these contracts that involve the CCBHC when fundamentally I don't understand exactly what it is, how it fits in. And I don't know if that was my fault and I should be doing a lot of homework to figure this out. But my impression is that this thing is, somewhat of a Leviathan, and I don't know that one person can do it. And I think that we really need to sit down and reach some sort of a mutual understanding about what it is.
Stephen, just probably something that might help you is we did have a presentation on CCBHC probably prior to when many of you were on the board. But it's a great idea to do something else again, just like we had talked about some of the other topics that we would like to address outside of a board meeting
Mhm.
and increase all of our understanding of them. So I appreciate your thoughts.
Yeah, I agree that we ought to be doing that. Because I imagine I'm not alone here on the board. And struggling through the mystery of what exactly this is. And the other thing I'm wondering is, I understand that, well, there's a handbook, and I think that'd be a good place for us all to start talking is from the handbook. But there's an advisory committee. And I'd like to know, who's on that? And since we're voting on contracts that involve the CCBHC, are we unknowingly part of this advisory committee? I mean, where do we as a board fit in when we're making votes, passing these votes about whether or not to approve these contracts that impact the CCBHC? I don't know.
Yeah, I think that's a great idea. Something that I'm going to talk about in my director's report is that, we've had these presentations lined up. And we're gonna, probably do those as trainings, board trainings. And we can put CCBHC on there as a board training and invite the right people. We've got staff who are dedicated to, that program and can give you the ins and outs. It is a pretty highly regulated program. We do have goals and objectives that we're expected to meet and pretty significant data requirements as far as what we have to report back to the state. So I'm more than happy to do a presentation on that. And hopefully at that point, we can answer all of your questions. The contract that's on here, the IBH contract, is a group that is going to help us with some of that data collection and analysis so that we can do those things. That in the past, you've asked for some evidence of, are we meeting goals? Are we meeting objectives? Who are we serving? What are the risks and benefits of the CCBHC program? That's what this organization is going to help us with, among other things. The other thing that organization is going to help us with is reporting outside of CCBHC. We have state indicators that we need to report on a monthly basis back to the department on timeliness and whether we're seeing people within a certain amount of days, recidivism back into state or psychiatric hospitals, that type of thing. I think that's outlined. I know in one of the emails you sent me, I had reiterated some of that information that we're hoping that this agency can help us collect.
All right. Is it kind of like fundamentally structuring a kind of an IEP for us? Putting together these goals and objectives? This IBH analytics?
I'm not sure I follow you.
Well, didn't you say it was something they're going to be involved in structuring some goals and objectives, or? No.
We have data that we have to produce for the state, for Michigan Department of Health and Human Services. And we have data collection that we have to do and analyze for CCBHC. And this organization is going to help us do that. Look with that information, create reports, provide answers to our questions as far as are we meeting goals and objectives?
Okay, I think somebody from there would be a great person to make a presentation to us to help us understand, I think, the CCBH and about, collecting the data and who is sharing it with and why.
We certainly could have, it's kind of two separate things. CCBHC is separate from the MIMBUS requirements, but we could certainly have them available to answer questions about what they'll be doing for us as far as data collection and analysis.
Okay.
I just had one question, Bill. It says there's 36 memberships. Does Community Action House have more people that need support with that, or how did that number come up? How did they come up with that number?
I'm really sorry. I don't know.
No,
Yeah,
it's
that was just, I'll find out and I'll let you all know that. With
We-
the-
We estimated
36,
those
yeah.
numbers based
Okay.
on who participated the year before. And, we can always, if we don't use all the memberships, I think we will based on what we've done in the past. If it looks like we might need a few more, we could always adjust it.
Okay. And then can I move on to a different organization? Are we
Mhm.
doing this one? Okay. I just had one more question about the Agnes Day. Here it says there is currently no one living in that placement. So is this just in case somebody moves there that they want to have the supports there, or?
No, we're hoping to move someone in and they might have actually already moved in.
Okay,
It's a new placement.
okay. All right. Thank you.
Okay. Thank you, Bill, for presenting those and answering our questions.
Oh, can I ask a follow-up question?
Is it for Bill or more for our
For Bill.
discussion? Okay, thank you. Sorry.
Well, maybe it is maybe it's not Bill, but Bill, maybe you can tell me something about this Regents of University of Michigan. And it looks like there's involvement of this MC3 project. And, is there something about that you can explain to us what exactly that is? I was given a sheet of paper that gave me some outlines about what it is, but I was wondering if you knew about it, could summarize it. I don't know if everybody here at the board has seen this information I've received.
I'll start and then,
Sure.
okay. So, yeah, so this is I couldn't tell you how many years. This is a renewal contract that's been going on for quite some time. And the program is designed to have clinical staff available to help facilitate consultations between primary care docs and U of M specialists. So if a primary care doc has some questions related to autism or mental health or, depression, perinatal depression or whatnot, they have a quick access to a expert. So that's really the gist of the program, is to help primary care docs in the community have that access if they need it.
Okay. So these are like telehealth or phone discussions that they have? Communicate this information?
Primarily it is, yeah.
I don't know. Maybe I got another question for you. Let me hang on for a second. I was talking to Lynn about this, about the ABA contracts, and our understanding is there are some clinics or facilities in the county where people would go to.
Mhm.
Do you happen to know where some of those places are located? I mean, what various towns they might be in?
Oh, yeah. So like in our contracts, we'll have the specific locations. So I was just getting into your email that you sent. Okay. Oh, that's good. That helps me understand. So what I was thinking about with that was, would it be helpful if, because like, for example, I'll say it's located in Zeeland, Michigan, if there's multiple locations, should we list all of the location? Would that be helpful for the one pagers in the future?
Yeah, I mean, when I'm thinking about ABA and I have some experience with this, I mean, access to centers to regularly go to with your child to go through the discrete trials and get some feedback and direction going forward are critically important. And so I understand there's going to be people are going to actually be coming to the home and working with parents and guardians. I just know from my own experience, it was helpful to actually go to a center too. So I wanted to find out if the centers are going to be actually convenient for people.
So we have both. We have in-home services, and that's a trained staff person who comes out to the family homes and actually provides the applied behavior analysis treatment therapy. They also consult with families and parents while they're in the home. We also have site contracts who have center-based, where the families actually bring the youth into the center to get their services done there. You can have both. Some parents prefer to actually have it center-based, some prefer to have it in their home. So as Bill said, we can put on that one pager where they're located. Many of these providers are multi-state. Some are very local. They only have services really within our catchment area. But I went through right before the meeting and found out where all of these are. If you want to know right now, I can tell you, or if you want something in the future that gives you an idea of where they're at, we can do that.
I mean, it'd be sufficient just to know in the future.
Sure.
We can put
add
the mental
that
picture
too.
together.
On the one pagers, if we have a contract that maybe has multiple sites, we'll put those down. And let you know if they're center-based or if they're in-home.
Okay.
That's easily done. There are a lot of these programs are located in Grand Rapids. We've got sites in Zealand, centers in Zealand, centers in Holland. And then quite a few, like I said, in Grand Rapids, and then most of these are in-home.
Okay.
Thank you.
Yeah, I won't monopolize your time anymore.
Are your questions
I think
answered,
so.
Stephen? Okay. Thank you, Bill.
Okay, thank you.
Is there a motion to approve the contracts as summarized in attachment A?
So moved. Or
It's been moved and supported. Is there any further discussion with the board about the approval of the contracts?
Yeah, I guess I'm just going to, I guess it sounds like I'm repeating myself. Before I think I can really make an informed decision about my vote when it comes to any of these contracts to deal with the CCBHC, I really need to understand what that is. And I think the retreat and the presentations are going to be helpful. And then the same thing with the ABA. Now, if parents think that's the best thing for their child to go through ABA, I mean, I support that. I mean, we did that for our son. But I also know from experience, it's a big time commitment, and that it may not work for families where both parents are working or it's a single parent. It may not work where a lot of the time the child is spending their day at school, because my experience is that there was always a conflict with getting it implemented at school because there's just different set of ideas about what's effective special education or in daycare. And so, I mean, I'm relieved to hear that, there are people who would come into the home to provide the training. I also wonder, how would that work in, say, the school environment? Because from ABI, I know from personal experience, it takes a lot of one-on-one attention. And just getting one-on-one for your kid in a public school IEP is a battle in of itself. Then you have to train the parapro to implement it and do it with fidelity. And so it makes me think about not, are there alternatives that maybe we need to discuss to ABA therapy that better fit in with the individual families that maybe aren't as time intensive? One of the therapies that I'm personally familiar with is like play therapy. And I thought that was good for developing social and play skills. The ABA I found was good for developing academic skills. And you hear a lot of talk about biomedical therapies. I mean, everybody's heard about the gluten-free, casein-free foods, nutritional and supplements. And I think we as a board really need to be informed, explore that and be informed about those things. And I'd like to know if these contracts did not pass or get renewed right now, what's the consequence of that?
I think I
Can
might
they
able
be
to answer
postponed?
That for you. And we have had a long waiting list of families who are seeking ABA for their child or their young adult. And we have been trying to increase the provider list for, I'm just going to say years. I know that it has been by the parents' request that we are trying to increase, and also geographically look where we can, provide services, that it is everywhere in our county. So we've sat around this table and talked about how we could get more providers for several years already. And when I see this list, I'm pretty excited that we have found more providers, or that more providers have come up. But just from my perspective, it isn't that we're saying ABA is what we're offering you. It's that the parents are saying, we want ABA, but we don't have a provider. And so that's where the contracts are coming from. Maybe I'm oversimplifying it, but that's what I've experienced as a board member over the years.
Okay.
And I
thanks.
understand from my former work in the schools exactly what you're saying about some of the issues and concerns regarding ABA. And, we can partner with families as they work through some of those things. There have been some creative ways that people have worked through them with the schools. It is kind of a different issue than providing what our wait list needs at this point in time. So
Yeah, I guess I'm pressing the issue. I'd like this board to, evaluate what are the alternatives that we can offer to the community.
So by all means, and we chatted a little bit about this, that's another area that if we would like our autism staff to come in and give a presentation to the board, that's something we can arrange very easily. They don't only stick with ABA as a treatment modality. They're using other treatments as well. We have people involved in play therapy. We have people involved in other types of therapy who have autism or on the ASD spectrum. So it's an evidence-based therapy, meaning it's got lots of research behind it and there is lots of success, but you're right, it's not the only thing to do. So part of the reason we've been pushing out those one-pagers ahead of time is so that we could get questions answered prior to the board meeting. I don't mind at all talking about them, but what ends up happening if we don't sign contracts, then we've got providers out there who might not get paid and can't provide services. They're not getting paid for services. So I know we've got a lot of new board members, and I'm more than happy to set up times where we can do training for the board. We can provide whatever information you like, question and answered. I just have to have the ability ahead of time to get staff lined up to do that so that we can give you a thorough presentation. Bill certainly is not going to be able to answer all of the questions you might have about the autism program. And I probably can't do it justice myself either. So again, more than happy to provide you guys with whatever information you want. I just need to know what that is. It'd be nice if we could do that before these contracts came to your attention so that you had the information you needed in order to make a decision whether or not to approve them. I can tell you right now, though, for the autism contracts that are on the agenda today, we're already contracted with them. This contract amendment is for a 3% across the board increase. We agreed to that as a region. We try to keep our rates about the same throughout the region so that there's not a whole lot of competition, meaning in a very scarce resource environment, we don't want one of our neighbors to pay, $1 more an hour or more per unit. So everyone wants to work with that particular CMH and not us. This also includes in it the direct care worker pass-through rate increase. So if we don't send these contracts along, we can't give them the direct care worker increase that the state had approved already. So we're just sort of backing up the system as far as getting these increases out to providers.
So as far as these increases, we're basically just passing on the money that's been allocated to CMH from the state?
Part of it's the direct care worker pass through. Part of it was an intentional 3% increase.
Okay. And I was wondering does it have any impact on the budgets for other categories of spending for CMH? I guess I don't understand the capitation process completely. I'm trying to think, is it just a lump sum of money, or is it given to CMH under various categories and can only be spent under various categories for various things? And if there's more or less spending in one category, is that shared in the other categories?
So, yes, we are at the beginning of the year told how much to expect as far as revenue from the region that comes down from the state. The money is given to us we call them buckets. There's a mental health bucket that includes mental illness, developmental disabilities, and then there's an SUD bucket that this year actually both of those, we're reporting out both of those funding sources under one revenue source. At the end of the year, we have to budget separately for substance use disorder services and mental health services. At the end of the year, we can combine some of those funds to, if we're overspent in mental health, we can use some substance use disorder money to offset that over expenditure.
Okay.
Sylvia.
Yeah, I just wanted to say, I'm really supportive, Stephen, of you bringing up these other resources, the play therapy, biomedical. I think OT can be helpful to these kiddos. But so I guess my question is, I would like for us as a board to continue to look at those other possibilities, to expand the resources available to our families. But does voting on these contracts preclude us from being able to do that? Or is that something that we can continue to work on going forward in addition to providing ABA? Because there are so many different kinds of services that families do like to utilize. And some try ABA at one point, and then they might move to something else to see if that works better for their child. So does that preclude us from doing that?
It does not, no.
Okay.
By all means, if there are, first of all, like I said, we are definitely using different modalities for treatment for autism. And I can bring in my staff, we can do a presentation, they can explain what those are and what's available for families. We are interested in learning if there's things out there that people also would like to become involved in. There are, Stephen, as you said, Parents have tried a lot of things, some things work, some things don't work. So we're happy to do that. And no, it would not preclude us. So person-centered planning does just that. At the meeting, you decide what's the best fit and work, what you want to work on as far as goals and what type of treatment you would like. So if you, it's not like we budgeted X amount of dollars in autism and we can't use that for a different kind of treatment. We can do that.
You know, if that gets into the person-centered plan, if there are other, you know, alternatives that parents want to try, but they're not Medicaid funded, are they funded then through the millage, or do grants come in? How would that work for the various alternative treatments?
Well, we'd have to think about that. If it wasn't a Medicaid covered service, we would have to look at other funding sources. Millage might be one of them. It could, grants are typically very specific about what they'll pay for, but there might be a grant out there for an alternative type of therapy. We could explore that.
Sylvia, thank you.
I would love to see that. I'd love to see us explore that, and maybe that's a day away, you know, where we go and we talk about what are some strategies that we could utilize, what are some more funding sources. You know, as we work towards the next millage, this is a huge need. And a lot of services for children with autism and even like sensory needs are not covered by insurance or Medicaid. And so that might be something that would be really worth talking about as we enter into a potential future millage for CMH. Like, how can we come around and support some of these families, because it can be very, very expensive. So anyways, I would personally like to see a lot more discussion on that.
Yeah, I think that would be worthwhile. Absolutely.
Thank you. And probably even looking at what we currently offer, I mean, what people are currently receiving, and your autism team would be excellent in helping us know more of that. So great.
Yep.
Thank you. Any further discussion? We have a motion to approve the contracts as presented in attachment A. All in favor, please indicate by saying aye.
Aye.
And opposed, same sign.
I'd abstain from that one.
Thank you. And then we'll move on to our financial statement, which is attachment B. And we have Amy here to talk us through that again. Thank you, Amy.
Hey there. So today we're presenting financials through the first quarter of the fiscal year ending in December 31st. So October 1 through December 31st. For both the mental health and SUD fund and the millage and grants fund. Mental health and SUD fund continues in a healthy position. You'll notice that while revenues are reporting as under budget, so our expenses, a lot of that is due to timing of payments for our encounter detail, as well as this, you know, it's the first quarter of the year, so getting all of the expenses billed. It's just starting to pick up month to month. We have our residential services usually billing about a month behind, and we have still working on our fiscal year 23 cleanup and audit process. So it's all kind of a balance, but we're in a healthy position, remaining ahead of revenues, and slightly under target for our year-to-date budget. The plan, so that's the mental health and SUD fund. I don't know if anybody had questions on that before I move on to the millage and grants.
Yeah, I have a question.
Mhm.
When you'd given me this draft, and I'm just wondering, where does that fit in? Because it was, you told me it was about the contractual services. I'm looking at contractual services under mental health and SUD. And then then there's the next page, a statement of activities for the period. And I was wondering, where does that fit into? Or is it somewhat like a hybrid of both?
It's a hybrid of both. So he's referring to, we handed this out. Everybody should have a copy in front of them, the one pager. This is based on some comments you had made, Stephen. We can break out our expenses really any way you would like to see them. I think when I chatted with Amy just this morning, we kind of pulled this together as an example of what we can do for you, if this is how you would like to see this. This could be all contracts, and not in-house and contract services, if that's how you would like it to be presented.
Yeah, I think at the last meetings I was talking about, give me some categories, you know, and it says contractual services, you know, bullet point. What exactly is that and how much? Now, I was just wondering, this document that you passed around, does that serve the purpose of the bullet point? Or maybe you were suggesting that that bullet point is actually more expansive than this?
So, if we want to isolate just what our expenses are for our contractual providers, this handout has more than just that on it. So we can modify this to have those categories that you're talking about. So for instance, our licensed residential it's all contracted out. That work is all contracted out. Our autism is all contracted out. Our autism services. Clubhouse is contracted out. Some of these though, for this is kind of just something for you to bounce ideas off of if you like the way this is set up. This current report has both internal and contract services. So we can isolate just the contract services on this graph for the future.
Well, since you made that distinction, maybe that's a good idea, is to separate them so we know.
Sure.
And then going forward for each of these meetings, then when these, we have discussion about the finances, and expect that we'll get this attached or something like it.
Yes.
Okay.
I'll send out a draft prior to the next meeting, just to make sure that it looks the way you want it to look.
Okay.
Thank you.
Yeah, this is based on the state's standard cost allocation model, so it just pulls right out of the general ledger. Both contracted and direct run services, so we can certainly do more drilling down for that detail you're looking for.
So these are the categories you already report on.
That we're reporting for the state.
This looks like it's a quarter, so you're looking at doing that on a monthly basis then, is that?
Correct.
Okay.
Okay, so millage and grants fund, similar in a healthy position. The target percent for millage to grants, I think we talked about this in the past. We have a lot of one-time payments that are paid up front at the beginning of the year. That kind of, we catch up as far as percent actual to budget spent. I don't know if there are any specific questions for the millage and grants. Okay.
Property taxes represent millage, correct?
Correct.
Dollars.
Yes. And another thing, the year-to-date actuals are a little low because we haven't started collecting taxes yet. So that number will increase over the next few months as taxes come into the county. And then additional year-to-date expense detail by program, kind of in two different formats. And then the revenues by funding type. And you'll see that our Medicaid funding is budget to actual. We're a little ahead with actual. We've received more revenues than we had initially budgeted at this point. So.
Okay. Anyone have any other questions for Amy?
I have a follow-up question about the year-to-date revenues by funding type. I see that there's a bar there, graph for grants. Will you be able to, maybe at the next meeting then, bullet point the names of those grants?
Sure, we can do that.
Okay, any further questions for Amy before we put the motion on the table for a vote? Is there a motion to approve the December financial statements as presented?
So moved. Support.
It's been moved and supported. Is there any further discussion? All in favor, please indicate by saying aye.
Aye.
And opposed, same sign. The motion carries. Thank you, Amy. Are you going to talk us through the LRE?
I can answer any questions if
Okay,
anybody had
the-
questions about the.
Next on the agenda, again, we appreciate you putting that together for us so we can just take a look at where we are in the LRE and how everything stands. Does anyone have any questions for Amy? This is not something that we approve by vote. It's just for our information.
Yeah, I have a question about the variance. Let's see, it's 53.2.4%. Can you briefly explain, the receipts and expenses that occurred to account for that variance? Kind of fill in the details about what happened so that a variance of increase has been reported.
So, well, first of all, just to clarify, this is a report, the financial status report for the region, which is reporting on October and November. So they're usually 1 month behind, and that has to do with the lag in time from our encounter data informing what our revenues are going to be, if there are any adjustments, if we have adjusting enrollments. The gap here is based on the fact that CMH of Ottawa County, we report actual expenses paid, not encounters incurred, not service activity detail. So we don't record the expenses until they're paid. We don't accrue the revenues, we don't accrue the expenses. So what happens is we earn our revenues based on prior encounter detail on a monthly basis, but we only record what we actually paid out. So we've had all this service activity, but we haven't been billed by providers in October and November. We're collecting, as I said, we're kind of a lag. So that gap closes as actual expenses come in, as we're billed, as payroll for direct run services are accumulated over time. So it's kind of the way that we report. It starts with a gap and it closes toward the year end. Other CMHs that maybe have closer, they do what's called IBNR, or incurred but not recorded. So they report actual service activity and then they reconcile as they pay in the future. We report exactly what we paid and then reconcile the encounters back to the expense. If that.
Yeah, what would that number look like if you had actually, went with like what the other counties are doing with their?
Look, I can get that actually, because we have it. What we do is we, to get our indirect expense calculation, we take the detail from our electronic health record and we cross-reference it with what was paid out. And then we do a percentage of indirect expense.
When you say indirect, is that administrative?
Yeah,
costs?
and yes, all of the indirect charge, IT and administrative charges, yes. Oh, and this is November. Well, let me send you that information. I don't want to
Sure.
speak out of turn, and this is a different month, so I'm not as familiar with 2 months back. So, but it is something that we're looking at because of some changes that the LRE is doing to accommodate the CCBHC reporting, asking that we accrue our revenues back to the month to the service activity month that they are tied to. I'm actually considering that, readjusting how we actually report. So we may have change our reporting method going forward for this particular regional document. But generally expenses, we're paying actuals and that's what we're reporting. So
I'm surprised they don't have a standardized process,
I
just
know.
even for this purpose.
Yeah.
We're all
Well, and
looking at the
even-
Same thing.
Yeah, there are some CMHs that they do all incurred, not recorded. But there are some that do by category. So maybe their inpatient would be IBNR, but their actuals for every other category or residential. And, it's like a weird mix. So we're discussing that at the region, but right now that's kind of where there's a wide gap in how people report and where they end up over and under month to month.
Is it possible then report like in parallel, the incurred versus actual?
Mm-hmm.
Okay.
Yeah, both of those detail. I have all that information, so we certainly can provide that.
All right, any other questions on the LRE report? Thank you, Amy. Thank you. And next on our agenda, Lynn, is the Executive Director's Report.
I'll give you some information from the state, from Michigan Department of Health and Human Services. They are rolling out a new standardized clinical assessment for children. The project is called MichiCANS. CANS stands for Child and Adolescent Needs Assessment. And this assessment will replace a previous assessment known as the CAFAS. We use this information to inform the process of person-centered planning. And we are familiar with the CANS because we're already using the adult version, which is the ANSA, to help us with outcome measurement. And again, using that information to help with person-centered planning to talk about where a person's needs and strengths are. So we'll be, I believe, October of 2024 is the rollout date. So we'll be getting training for our staff in that process. From the Lakeshore Regional Entity, I've talked a couple times about the region asking the department for more HSW slots. HSW is habilitative support waiver. Those waiver slots bring with them increased funding per slot. There are over 350 open waiver slots throughout the state of Michigan that other PIHPs are not using. We use all of our slots in our region. We just found out that we are getting 30 slots from another PIHP, which will help with revenue, bringing more revenue into our region. And the hope is that we'll get more than that. Of those 350 open slots, it seems a waste to not use those if other PIHPs are not using them. So I'll keep you up to date on that. I guess the good news is 30 is better than none. I let you know that our annual site review is coming up February 5th through the 9th. So we are in the process of gathering all sorts of information that we'll need for that, including review of clinical charts, credentialing, various committee work that we do is all part of that review. From CMH, we're still struggling with staffing. That's something I say every time. We've been hovering around 14 vacant positions. What it seems like lately is we've been promoting from within, which is a good thing. But then that obviously leaves a hole where that person left. But we continue to work in that area. I wanted to let you know that our Children's Mobile Crisis Unit is up and running, and that's been announced to the public. I know I've said this for multiple months that it's in the process, but it actually now is up and running and available to families who live in Ottawa County with a youth age 0 to 20 who might be experiencing mental health crisis. The program is available Monday through Friday, 5 to 12 a.m., 5 p.m. to 12 a.m. It helps with a crisis intervention kind of visit, safety planning, referrals to mental health services. It can be done in person, or we can do it over the phone. And there is follow-up associated with it. So once we do a visit or we make a phone call the next day, next couple of days, we'll recontact that family and see how things are going and make sure to the best of their ability, they're following through with some of the stuff we recommended. So that information is on our social media platforms. If you go to Facebook, hopefully everybody has friended Community Mental Health of Ottawa County, and you can see some advertisements, not only for the new Children's Mobile Crisis Unit, but we've also done some pretty cool videos lately on recovery. The videos were recorded at the Recovery Fest in 2023. And they're pretty awesome videos. They're people who are talking about their own experience. And they're pretty inspirational. So if you have a chance to check those out, they're on there as well. Something that we've also just recently advertised on Facebook is the GRCC Grand Rapids Community College Direct Support Professional Training Program. I've talked about that a couple times. We're on the second cohort that started this month, and there is a really good video. If you go to our Facebook page and click on the link, there's a really nice video that GRCC did that explains what the profession is and how important it is to families to have that kind of worker and group homes to have that type of help available. A little bit on the millage steering committee. We had I thought, a very good meeting the last time. We've still working on final recommendations for the social rec programs. And right now what we're concentrating on is looking at financial information and coming up with a method that we can review the metrics of the programs against the budgets. So we have another meeting coming up in a couple of weeks. I think that's a really productive committee. So like I said, I think we'll be able to come back with some recommendations soon. And we've got a lot of other work to get started on. There are other millage programs that we're going to be looking at and reviewing. And we have programs, community programs out there who have actually asked for some millage dollars if we have some. So that'll be another part of that millage steering committee, is to review those new requests. We talked a little bit about it, but the board trainings that we're going to be setting up, we had you guys go through the effort of prioritizing what you wanted to learn about and what you wanted to hear first. Last month, we had the Access Center present, and I think what I came out of that was there's not a whole lot of time for discussion and question and answer. So I really think that training sessions, separate work groups would be a really good idea, so that you guys can get all of your questions answered. And then we'll report back out on that at future board meetings so that we can also share it with the public. So Patricia is going to help with a doodle poll. Everybody's probably doodled to death with polls, but hopefully we will get some dates on the calendars, and I think we'll plan for an hour, 20 minutes of a presentation, and then questions and answers for the rest of that. So we'll get those scheduled hopefully starting next month. And that's all I have for today.
Any questions for Lynn?
Yeah, I just want to make sure I didn't misunderstand. So when you're talking about the habilitation support waiver slots, did we actually get those, or we're in the process of applying for them?
So the region is allocated a certain amount of slots. And we regionally, we submit applications to the region, and then those get sent to the department, Michigan Department of Health and Human Services, to approve that individual to be given one of those slots.
So those 30 are in the process of being approved, or they have been?
I'm not sure if it's final, that they've actually been, what I do know is that another region said we could have them. It has to go through the department, but it's my understanding that the department has agreed to that. So the next step in the process is we will submit applications. The entire region, the Lakeshore Regional Entity actually does that submission to the state.
How are those distributed? It's HAB waiver, correct?
Yep. Mm-hmm.
And could you, how are they distributed and can you explain what a HAB waiver is, who it's for?
Yep, it's for individuals with intellectual and developmental disabilities who are at risk for placement at a higher level of care, a state hospital type of care. So it's extra dollars intended to help that individual continue to live in their community.
And then do you know how they're distributed? I mean, are they allocated by number of people who might qualify in a community, or how is it determined by the state?
That's
Since
a
we're-
really good
we're
question.
Borrowing from somebody else.
Yeah, I don't know exactly what their methodology is, but I can find out for you and I can let you know.
And then on your children's mobile crisis unit, you said the age was 220. I missed
0 to 20.
It was 0. Okay, 0 to 20. And the hours of operation again, 5 a.m. to
5 p.m. to
PM.
12 a.m.
12 a.m. Okay, good.
Monday through Friday.
Gotcha. Thank you.
Lynn, I missed the age on the new assessment for children. What age does that address, the assessment that you'll be using, which was the first item you talked about?
I'll have to check on that for you
Okay,
as well.
I just wondered, I know a little bit familiar with what was previously used, and also
Sure.
with the one that's being used for adults, is there a gap, or does it take people right through with that same type of assessment?
It's the cans hits a certain age and then it's the ANSA. So it's the child version and then the adult
And the
version.
adult
And I will have to check on the
Okay.
years for you.
Okay.
I'm not
All
entirely
right.
sure.
Thank you.
Mhm.
Thank you for your report.
Yeah, I think it's 17, but I'll check and I'll get
Okay.
back.
Thanks. Any other questions for Lynn? Then we'll move on to general information, comments, meetings attended. Anyone have anything to contribute today in that category?
I think I just want to piggyback a little bit on Liz and her report, because I did attend the millage review committee meeting, so that kind of falls into that category. But I think I've said this before, but I really want people to know that I've enjoyed being on that committee. And coming into the next millage in 26.
Yeah.
Right? So just putting eyes on it and giving some oversight to it has been a really great learning experience. And I think it's just really important to know that in the time from when it started till now, we've changed a lot, right? A lot in our community has changed. The needs continue to grow unbelievably. And just before coming here, I met with a dad who has a daughter with Down syndrome. And he said, I need a place for her to live. There just isn't enough. And, just kind of quote something like the laborers are few, but the needs are huge. And so if we can continue to meet the people of all the needs that we have in our community, high needs especially, because we need to help them, I think, first, but whatever. But I just want to say what Lynn's like, I've really enjoyed being on that committee and just putting eyes onto the organizations that have been helped, but to know there are other ones that need help too. And if this housing, or if it's, adults over 55, if there's other needs in that social rec, whatever, I think it's just been a really good exercise to go through this review of the millage. And so I enjoy sitting on that committee. I don't know what you think, Chris or Stephen, but I do enjoy learning and seeing over the last, 7-8 years, maybe. Does that sound about right? Started in
It's a 10-year
20
millage, so we're at
2016.
Mhm.
Yeah, so it's just been a good thing. So I just wanted to share that.
And we appreciate all of you who are involved in that committee and the work that you're doing. So thank you for that. Any other general information or anything else meetings attended. Then I'd like to open up for public comment. Once again, the last opportunity at this meeting. Is there anyone in the room who would like to make a public comment?
Lori Grassman, Robinson Township. I would like to thank Donna for that little explanation about the housing, because I do think that that is a huge need in this community, because I have one of those high level children that need housing. She's 25. She's going to be aging out of school. And as much as these social rec programs sound so amazing to everybody when they stand up here and talk about it, they're not for my child. They're not for these high level children. We have nothing. When she ages out of school, there will be nothing. So as much as I love these social rec programs, we need to refocus, bring it back to what is actually needed ASAP. And that's going to be housing. Because if you don't create housing, you're going to create such a big problem with the families, because I'm not going to be able to do it forever. So I think that's where we need to go. Proms are nice, but bedrooms are better. So thank you.
Thank you. Is there anyone else in the room who has a comment they'd like to make today?
Rosalie Austin Holland. I got this about CCBHC in the mail. It says contact CCBHC, and there's pages and pages of events and activities for CCBHC, which is still a huge mystery to me too. I'm still not sure what data you're collecting and how to integrate the physical with the mental health. But one thing, the Community Action House has a nutrition meeting, which should piggyback off the contract approval for the food club. But the nutritionist, I wonder if they're going to do more teaching about food allergies and cross-contamination and how to eat fresh and that sort of thing. And I do think that we should have mentioned self-directed services as a way to help meet those unmet needs of people with their creativity and their budget allocation. And I would like to talk more about that, because we have a parent group for self-directed services that we worked with the ARC of Michigan, and it's called Partners Advancing Self-Direction. And we are going to a national conference in Baltimore, Maryland in March. So I've been waiting for an announcement about that, and talking to the partners, they said they would like to be invited to do the presentation to our board and our county commission, LRE, and share our creativity with that.
Thank you. Is there anyone else in the room who would like to make a comment today?
I know I'm kind of out of turn here, but it just triggered a memory that I had regarding housing that Lori brought up. There are 2 projects in northern Ottawa County. Would you want to speak to those at all? I know I'm putting you on the spot, but
no,
there are some housing options.
Yeah, so Gracious Grounds is a organization up in the Grand Haven area who's been around for a couple of years. They provide supported independent living apartments, typically, where folks can live. And there is some supports available. It's not 24-hour supports, but it definitely helps with some community access, getting together, but it also can help with reminders about cleaning, cooking, that type of thing. And they are set to open and start construction on, I believe it's 70 units. This coming summer, they're going to be starting. So that's huge, obviously. And then there's also another program in Spring Lake that is supported housing. I think that is 55 units. I'll have to look. send an email out, but I can't remember the
Mhm,
exact
yeah,
number,
I don't have my
53
computer.
units, 55 units. And that isn't necessarily only for our folks. That's for folks who are, who might need some supports as well, but, that could include the broader community, not just people we serve. But as those progress, I can keep you up to date on where we're at with that. The Gracious Grounds one is pretty astounding that they got some
That's exciting.
MISHDA dollars to help with that.
Good. Is there anyone on the line who has their hand up for a comment? All right, is there a motion to adjourn our meeting today? It's been moved and supported to adjourn our meeting. All in favor, please indicate by saying aye. Aye, and opposed, same sign. And board members, if you could stay around with your calendars for a couple minutes,
Yeah.
hopefully we can come up with some, thank you.